Virtually every health indicator suggests that the health of Indigenous people in Canada is significantly poorer than of the remainder of the population, although the gap in life expectancy between Indigenous people and non-Indigenous Canadians have been narrowing. The average life expectancy for Indigenous people is 15 years shorter than non-Indigenous populations in Canada. Higher adult obesity rates exist in Indigenous populations. First Nations and Inuit 26%, Métis 22%, and non-Indigenous populations is 16%. Infant mortality rates are 2 to 3 times higher, and incidence of diabetes is 4 times higher in Indigenous populations compared to non-Indigenous populations. These are just some examples. The list keeps going. The disparity in health for Indigenous populations is truly astonishing, and to look at solutions, it is first important to look at the causes. Racism exists in many different forms, which include structural or systematic racism, relational racism, embodied racism, symbolic racism, and social exclusion. The Indigenous people of Canada continue to experience the impacts of racism. However, the ways this intersects into their particular identities is unique in terms of the discriminations that they face beyond the socially constructed categories such as gender, disability, sexual orientation, class, and age, which are identifiers that we have a more common understanding of. According to a report conducted by the First Nations Regional Longitudinal Health Survey in 2005, 38% of Indigenous people had experienced at least one act of racism within the last 12 months, with 63% of them reporting that this has impacted their self-esteem in one way or another. On a larger scale, this often looks to Indigenous people like being othered by settler groups within Canadian history, aiming to rationalize colonial actions to their disadvantage in harmful and oppressive forms such as stereotyping, stigmatization, and violence. A number of different negative stereotypes have been widely known to be associated with Indigenous people over the years, including assumptions about the pervasiveness of alcohol and drug use, unemployment, and violence. In the media, news reports surrounding Indigenous communities often focus upon social and economic challenges, which fails to also convey the importance of stories pertaining to discrimination or exploitation by people in positions of power or authority. Furthermore, the media has continued to perpetuate these damaging and demeaning stereotypes, often depicting Indigenous people as being dependent on the federal government to oversee their affairs, thereby being unable to have the right to determine their own fates and internalizing the generations of belief in not providing them with their own autonomy. Additionally, there are many other economic, social, and political parties within society that create and reinforce acts of discrimination. For one, the reserves that are established in place for these communities are often made with inadequate investment, creating conditions of inequity and disadvantage. All in all, this has worked to create relative poverty amongst these populations, where diminished investment has led to ventilation and mold, as well as overcrowding as an example. Elsewhere, educational programs have also been significantly impacted, whereby inadequate funding has limited opportunities that these populations have access to higher order employment. The residential school system that is put in place also acts to assimilate Indigenous children at the institutional level, despite best efforts that have been put forward outlining ways to provide culturally rich on-site education for these communities. Rather than supporting the efforts that have been currently put in place, the government has worked instead to run programming that does not acknowledge traditional Indigenous lessons and forces children to travel off-reserve far away from their families. Another largely systemic injustice that is in place is the ways in which both the justice and healthcare systems fail to provide adequate care as intended to serve the needs of westernized Canadian culture towards groups of Indigenous populations. One example of this is that Indigenous people that are categorized as offenders are much more likely to receive imprisonment sentences when convicted of a crime compared to their respective counterparts, in addition to their general treatment and representation in the Canadian criminal justice system. So the question remains, where do we go from here? For one, many of these disparities exist as a direct result of racial discrimination, as detailed in great length throughout the course of this video. As a society, we need to revisit the specific ways in which marginalization of these particular groups has intersected to affect both the physical and mental health of Indigenous populations. Based upon these factors, which have dramatically impacted areas in their lives such as land use, government structures, residential schools, abuse, and violence, many of the decisions that have been made over time have gone beyond the individual level and in turn inform institutions that impact and perpetuate racism against larger populations of Indigenous people. In order to work collectively to amend long-standing histories of trauma, we need to re-examine large-scale systems such as the justice and health system and see the ways in which racial prejudices are addressed at all different levels in order to embrace the unique cultural traditions and examine the specific needs of Indigenous people. Additionally, it has been evident over time that the media plays a very strong role in the public's perception and understanding of Indigenous cultures and values. Rather than placing assumptions within our knowledge and education of their contextual considerations, we need to find ways in which we can respectfully integrate ourselves within our understanding of their lives and work with them to address their needs in a conductive and appropriate manner.